Welcome, everyone. This is Coffee with the Founder, when we sometimes drink coffee and mostly not. Honestly, I'm drinking
It's
just
late in the
sparkling
afternoon.
water. What about you, Oliver? Yes, it's late.
I've actually got a large stein of green tea next to me. So if you
Perfect.
see
We're doing
an aggressive
tea.
amount of green tea,
We're progressing here. Just sparkling water and tea is
yeah,
now more the
I've had
vibe.
plenty of caffeine.
Oliver, Oliver Keown is the CEO and founder of Oath Surgical, making outpatient experiences far, far better because
That's right.
it's a difficult experience getting outpatient help. And I'm just recalling, Oliver, years ago, right 2020, actually, and this is an old BAM story. I had my wrist operated on because I broke it at a BAM event. You could see my fabulous scar.
Sounds fun.
And wow, I went in, I had the most amazing orthopedic surgeon. Okay, great. I woke up, and I am telling you, Oliver, it was like they were pushing me, practically put like, okay, you're good. You're up. Like, roll out the door. And I'm like, holy hell, I'm throwing up because just the anesthesia and everything. Oh my gosh. So what are you solving with Oath? Because I'm hoping it's a better experience in your outpatient care.
Yeah,
Mm,
that's absolutely right.
mm,
I've had the fortune to see healthcare from a bunch of angles, like yourself. I've been a
yeah.
patient, but I trained as an MD. I've been a venture
Yes, you are an
capitalist.
MD.
I've
Yes.
been now a
Quite the
founder in the
trifecta.
healthcare
Now you're a founder.
space.
Now I think you've gotten it all, right?
Yeah,
Health tech
well,
founder, VC, doctor. Got it. Done.
trying to bring it. And so
Yeah.
I've seen a few things as it relates to surgery, and my whole career has been kind of focused around medtech and
Mm,
surgical innovation. And I think what dawned on me is that the opportunity when surgeons and care teams have the right technology, they have a premium and thoughtfully designed space to deliver high quality care. And when that is outpatient, you can dramatically lower the cost of surgery. You can deliver better quality outcomes. And I think, to your point, deliver a much more thoughtful and
yeah.
cohesive experience from that point of
Hmm.
referral onwards. And
Hmm.
that's what we're trying to kind of blend the consumer choice and opportunity to be where they want to be, to work with
Hmm.
providers that really care about how you're
Hmm.
getting treated, the outcomes of the surgeries that you're having, and do that in a setting that is lower cost and higher quality. And that's what we're
Okay.
building.
So that's one thing I want to point out. You have physical locations. This is
That's
surgical
right.
centers along
That's
with all
right.
the technology side. So you would go here to get handled with a bunch of different things. You have gut, you do women's health, Actually, give us the whole overview, but I want to emphasize, like, no, it's physical settings
That's
alongside
right.
all this technology that's powering the outcomes.
That's right. That's right.
Yeah.
And when I was a VC, I was investing in technology companies, and what dawned on me is actually we have to rebuild the physical and blend that with
Yeah.
the digital and the med tech innovation to actually move the needle on surgery. You can't just do one of these things; you have to bring it all together. And our centers are really aimed at delivering what we are calling higher acuity, but think of it as more complex surgery into this outpatient setting, a setting that's local, it's convenient,
Hmm.
it's premium in terms of aesthetic, but it is equipped with hospital grade technologies and surgeons aligned to this setting that allows us to do really complex surgical care. So we're doing advanced orthopedics, advanced women's health, gynecology, urology, but also actually surgical oncology and moving into cancer surgery and things like
That's a
that.
lot.
And
Yeah. Plastic surgery
doing
too.
these these really important surgical cases in this setting, again, that's lower cost, which is a pretty big step change, but it needs
Okay.
that kind of innovation.
Okay, so how are you getting it at a lower cost? Because, Oliver, as I think about it, I don't want to be risking quality, of course, when you're
That's
about to
right.
cut me open for things. So how do you balance this?
Yeah, so it's the same surgeons. We actually quality
Yeah.
vet all our providers, and
Mm,
then we create. What was missing was a an outpatient setting. So
mm,
the reality of an outpatient setting is we're effectively taking the surgical department of a hospital that has a lot of expenses and a lot
yeah,
of bureaucracy and a lot of inefficiencies,
quite.
and we're creating an environment that is absolutely optimized for delivering world class, laser focused, best experience surgical care. And when you do that in a setting that's only a couple of ORs and a beautiful waiting room and a beautiful place to recover, you can
Mm.
reduce the cost of care by up to 80% in some instances, which is wildly kind of exciting for the healthcare system. And it's really a testament to how expensive and inefficient healthcare's got that
So
this
that was my
opportunity
next question.
exists. That's right.
Why? And it is because the healthcare system we have is absolutely hugely bloated by so much. It's actually preposterous, really,
That's
I
right.
would
That's
say.
right.
Yeah.
And for us,
Okay.
what we can.
Go ahead. Go ahead. And for you. Yeah.
I just going to say, no, just, when you can do that, you can kind of give some of those savings back to the patients. You can give savings back to the healthcare system. You can give the savings back to the surgeons. You can create this much more sustainable model,
Hmm.
which is kind of the value-based part of what we do.
Hmm. Do you miss being a doctor?
I gave up that part of my career
Yeah.
early, and I really enjoyed it, and I loved the
Hmm.
communication side of it. I loved the
Hmm.
challenge of navigating tough patients, of kind of the problem solving associated with it. But I have been fortunate to kind of forge a career subsequently that allowed me to kind of continue to flex those muscles while learning a lot in different areas. And I feel like it's kind of taken me to a point through those different experiences where I can have an impact in a different way. And I get to,
Yeah.
the credibility of having done it allows me to converse and collaborate and partner with surgeons, with care teams in a way that's needed to kind of bring this fairly complex model together with the tech, with the physical settings, with the care teams that work with us. But the short answer is I do miss it sometimes, but I get to live and breathe it every day. So not so much.
Yeah, you're not in it with the patients, touching them every day and not doing the doctor piece, but you're in the orb of it. So it's just a
That's right.
career hopscotch a bit,
Yes,
if that
that's
sounds
right.
correct. Yeah, I would say
Yeah,
that.
that does.
Okay, got you. Okay, now when we first were about to record this, you said, "Oh, last name Ireland." So how'd you get over here, and why did you get over here? Frankly,
Yeah.
America's a
So I
wild
was
place, as you've maybe finding out. Yeah,
It is, yeah. So
yeah,
I had Irish parents, born and raised
yes,
in Scotland, rural Scotland, outside Aberdeen in the northeast, and I think I was always attracted to bigger and bigger cities and urban environments. So I went to medical school in Edinburgh. I moved down to
yeah.
London, where I practiced as a doctor, and then went into kind of academia and
Mm.
health policy. And then I had the opportunity to come out to the Bay Area. While I was in London, I could see where venture was going. I could see where startups were going, and it was the classic that everything exciting was happening on the West Coast. And this was about 12 years ago. And
Yes.
I had the opportunity to make the leap with my other half. And so we just decided to bite the
Oh,
bullet and make that
oh,
leap. And no looking back in that respect. But
fantastic.
I had to go back to the UK a lot and have family there, which is nice.
There you go. There you go. Okay, you're also doing, I'm just looking here at LinkedIn and studying up on you a lot. A Creative Destruction Lab. You've been an associate there, volunteer. You do a lot of volunteering stuff. What are you up to?
Yeah, yeah. So I
Yeah,
mean, just mentoring, and when I was a
yeah,
venture capitalist for 10 years
yeah.
and
So you're
investing
in
in
the
early
space.
stage companies. So it's deal flow, it's collaboration, it's mentorship, learning a lot from great founders, and candidly, it was doing all that stuff, getting exposed to amazing founders, that I got the itch and started to get jealous and started to get nervous that someone was going to pitch me this idea. And why I ultimately made the leap, because I saw the fun that founders were getting to have, the fun and the
The
all
fun.
the emotions.
Okay. Oh, wait, let's tap on that because yeah,
Yeah.
from 1,000 feet up, you're like, oh, it sounds so fun. You're just building all day. You're like cranking, 6 days a week,
Yeah.
whatever. Okay, how is it now that you're in the belly of the beast?
I do absolutely love it. I have absolutely
Yeah.
zero regrets on making this. It's
Mhm.
certainly my speed. I think 10 years as venture capitalist, I thought I had busy days. I thought I had highs. I thought I had
Huh.
lows. The
No, no,
no,
Oliver.
no, the viscerality and the extreme of those highs and lows when you're a founder and entrepreneur, you're dealing with incredible people, but the challenges that come with building a business,
Yeah,
having people say no, having people say yes. The highs and the lows do come all at
a
once
lot.
at the same
Yeah,
time, and
yeah,
but it's fun. I take energy from that, and kind of each day becomes its own unique set of experiences and
true.
kind of and challenges. So I haven't looked back in that respect.
It's true. Can we talk a little bit about the highs and the lows? Like, what's an example of where you're like, oh my gosh, this was such a high, this example. But of course, I'm going to ask you what's one of the lows because we can't,
Yeah,
tell me.
I think our for this model, it was pretty
Yeah,
ambitious, right? To start with
yeah.
surgical centers and AI and technology and surgeon partnerships, we had to close a couple of deals to kind of even get this up and running. And
Mm,
so the very first patient that we saw in our first surgical center with our surgeons that were part of the model, like that was a high. That was like, wow, we're actually doing something real. This is real patient care. This is real in real life kind of stuff. that was a huge high. And every week we get to experience that because we're seeing hundreds of patients, every month across our
Yeah.
centers. And but that first one was certainly, kind of standout. And yeah, like, it's but to your point, like every week you have all the emotions, which is part of the fun of being a founder.
Part of fun. Okay, so could you take us to one of those? Like, what's one of the ones where you're like, God damn, here I am in the bottom of the barrel? You don't have to get into details unless you wish to
Yeah,
disclose, but what's an example? Because I want more people to know, yeah, there's a lot of crappy lows. There
yeah,
are, and just dismal days. But then you get the next day, and that's where
that's
you
right.
step up and continue.
I think so much of being a founder is about people and
It is.
navigating the best and the worst of people.
Yeah,
You have,
yeah,
very high turnover of experiences with
yeah.
people. You're seeking partners, you're seeking
Mhm,
people that are going to collaborate. When you're early, you
mhm.
don't have a lot and you're looking for trust and faith and energy. And I think
Yeah,
some of the lows would be maybe disappointment when, people don't kind of rise to the bar that you're hoping to, or, the partnerships don't go
yeah.
in the directions that you want to. But that and you have to learn not to take it personally. That this is part of the journey and the thick skin that you're going to grow, to just learn that
Mm,
actually you're your only advocate, and you've got to go and build this and build a team that are hungry
mhm.
and aligned around that. And so, I think my biggest highs and my biggest lows have all come from, kind of the fun of collaborating with, kind of incredible people in all different ways. How about
Okay,
yourself, may I ask?
you said,
You know,
oh, yeah. Oh, people don't usually ask me questions. Okay. Yeah, the highs are when you feel, wow, we are just cranking, we are all aligned,
yeah,
the energy is insatiable, it's consistent, and you have that across the board, and you truly
yeah,
feel, wow,
it's
we
momentum,
can do anything. That is just the top
electric.
feeling, and electric for sure. The drag feeling, I think, for a lot of founders is when you feel, oh, there's just some people just not on board with this. And it's a drag of not only the people internal, perhaps, but then also external, where you're like,
Yeah,
oh, this
yeah,
isn't working. Why is this so hard? Why are we banging our heads against the wall? When it's hard outside, banging your heads against the wall, you have to have the inside be like, well, we're going to keep doing it. And when
that's
you
right.
have that
Positivity,
inside, that's the
pure.
thing. But when you have it inside the house, I think that is the most difficult part, or one of the most difficult parts for founders to deal with, because you're going, gosh, I'm the one who's pushing this train and pulling it and pulling the people along and so forth. And it's very tiring to keep pulling the train when you don't
Yeah,
have people going like, yeah, 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 let's get, So that's the drag, I feel, that gets you down.
yeah,
Just
yeah.
having people
I,
who are not on board and are just not there. And it's very few people that can exist in the turns and the tribulations of startups or a venture
yeah,
back
and
company.
keep the energy up, keep the positivity up, see the future, anchor on that. Yeah, absolutely.
Exactly.
It's
Yeah.
its own breed.
Yeah. Yes. Truly. Mm. What else is on your mind right now, Oliver? You've been doing this for now a couple years, almost 3.
That's right. Yeah, that's right.
How have you evolved as a
I would.
leader, as a founder now?
Yeah. So I had, I think the cliche of the founder getting to like experience different roles and getting to learn the different roles has been like one of the best privileges of this job, right? You start with a vision and you have to kind of start building the building pieces, and then getting to a stage where we're bringing on and leaders with decades of experience in their
Yes.
fields that
Yes.
have so much more to teach me about these areas and domains that can kind of take us to another level in the various kind of business functions and infrastructure that we're kind of at the stage of building out. Like that's a very exciting point of evolution. It's not just me
Mm.
winging it, across the board now. It's
Like,
like
hope
actually
it'll
we're
work.
getting,
Yeah. Yeah.
yeah, but like and I've been very fortunate to had very, very awesome team from day one, but
Mm.
we're just at this stage where the team's really, really clicking, and we're can really see the collective vision and the capabilities within the team to go and
Mm.
execute against that. So I think
Oh,
we're
that's the
just at this
best.
like fun spot. What to your point, where that energy is electric, and
Yes. Oh,
we all know what we want to be when we grow up, and so there's just like a kind of confidence that's kind of palpable, and that's been really fun to evolve into, I'd say.
oh, good. Okay, what's on the horizon for you then? Continuing this momentum, of course, but what else could you tell us?
Yeah, so I mean, for us, it's about growth of our model. So
Yeah.
it's we build surgical centers, and we partner deeply with surgeons who kind of align and invest in our facilities. We are
Mm,
bringing on more and more complex care into our surgery centers, and so we have partnerships with med tech companies and technology companies
mm,
to facilitate the ability to do these more complex care
mm,
cases, and then we get to partner with payers and what we call our value aligned partners. So TPAs and employers that want access to a network that is higher quality
mm,
and lower cost. And so
mm,
for us, there's like this, deep push around both building our centers and our technology stack, but also partnerships that can help us scale, and unlock value from what we're building. So we're really landing that, growing into new markets, and kind of taking this to the next level. We're in 2 markets today. The second's
yes.
actually not public yet, but
Okay.
we are now in the second, and then we're teeing up our third and our fourth markets for next year, which is kind of a fun spot to be in. Just traveling a lot, as I was sharing before, so on a lot of air miles, but it's all fun stuff.
When you have something you physically have to open versus, oh, I just sold it to 90% of the Fortune 1000s. Here's my software. Boop. How does that change your perspective of, if at all, leadership versus when you were in the VC seat going like, yeah, you just sell software, you could be anywhere, etc. The physical component,
Yeah.
how does that look?
Op- Operations, and I'm fortunate to be surrounded by some incredibly experienced operators.
Mhm.
I'm high on vision. My brain setting is like,
Yeah.
maybe slightly on the right with operational chops, but in the middle on the right. I have some incredible operators that can build stuff and
Mm,
do stuff, complex
mhm,
stuff at scale.
mhm.
The in real life component, that is hardcore operations. You need to
Yeah.
be able to execute. You need to be able to organize people and process and
Yeah.
technology to get stuff done. And there's no hiding. There's no hiding behind,
No.
because if
No, there's not.
patient care and quality and safety are our top bar, and we are accredited organization, like we
Yeah.
present our transparent around our data. So I think that brings like a rigor, which I love actually, and our team really love, but it
Mm,
sets a different bar in some ways. And then we are a technology company as well, and we are benefiting from that through our organization. But I think having this kind of physical element. Well, I'll also maybe just add that in the current kind of AI universe and all the energy and kind of hype around that at the moment, we also get to be our own customer of the technology, which is kind of a unique position to be in, because we're our own ecosystem.
yeah.
Our technology developers are walking the corridors of our surgical centers. They're sitting down with our nurses. They're spending time in the OR or outside of it with our surgeons. And we have these like very quick feedback loops around
Hmm.
tech development, which is kind of a
Hmm.
superpower as well, because it allows us to go very fast. And it's a benefit of having the kind of in real life component of our business, and not just selling into one and hoping that we get enough feedback to kind of iterate and improve on the next version. And so that's been another advantage, although it comes with the complexity, of course, that we just discussed.
Lots of complexities with this. Have you actually been a patient?
Not, I mean, touch wood, I have not required surgery since starting
Thank
this business. I
goodness.
have been a
That's
patient for
actually good. Yeah.
surgery.
Yes. Yes.
I
Well,
have.
you had the firsthand experience. Yeah. Yeah.
That's right. I have had surgery numerous occasions and seen good experience, seen less than
Yeah.
good experience. But our team members have had surgery in our network, and it's a real privilege to be able to support access and kind of that higher quality, lower cost piece
Hmm.
of that. And yeah, just we're very fortunate. Kind of a key part of our model is the surgeons that we work with. There are really, in many ways, obviously our patients are our number one stakeholder, but the surgeons that we work with are the ecosystem, the community that we're building. And
Mm.
so really get to work with incredible surgeons. They're very passionate about high quality care. And so that's been a
I would wonder
privilege.
though, just with surgeons, those are a particular breed, as you know. Is it weird having them understand this from like the VC backed technology component to it? Or are they business minded and they get it and it's easier than you thought?
So I would say that, and I'm a founder, I'm meant to be optimistic, and
Yeah.
you'd be skeptical of what I'm about to say, but one of the
Yes.
things that when we first started this company that I was most pleasantly surprised, and now we are just running with, is that the degree of need by surgeons. Surgeons want the best place to work. They want the best access to technology.
Mm,
They want to deliver
mm,
the highest quality care they can. And
mm.
in Oath, they have a partner to do that. We're delivering them a premium setting of care that they can align with economically. We're giving them cutting edge technology that they could only otherwise get in the hospital. We're layering all this AI and kind of workflow optimization around it that gives
Mm,
them time back. It takes away documentation, allows them to
mm.
understand their quality in a much more granular way. And so surgeons get that. They've been seeking that throughout their
Okay.
careers.
So this is a relief
And
for them.
we've had this huge lean in for this model, which has turbocharged, the growth that we've been able to kind of deliver on, and kind of the roadmap that we're executing against. But it comes down to, I think, surgeons wanting for more and supporting the independent surgeons specifically to be, to able to kind of stand strong, build, success, stay independent, all those things.
And just to get into the business model here for a second, as you're mentioning, like the independent surgeons. So these are folks that are not obviously in a hospital system. They want to be in their own facility, doing their own specializations, and not having, as you said, like the bureaucracy of
That's right.
hospital systems going on. Mm,
Yeah, they're running their own private practice, or we're
mhm,
bringing different practices together around our model and different
mhm,
specialties. So we're
mhm,
multi-specialty. I mentioned the various kind of
mhm.
examples: gyne and colorectal and general surgery and
Yeah.
plastics and ortho. Typically don't always get the chance to collaborate with a platform, and Oath really provides this neutral
Mm.
facility kind of anchored platform that allows them to come together, access the benefits, grow their practice.
Sounds like a dream. Who says no
It's
to
fun.
this?
Very, I think surgeons are seeing the opportunity, and they're seeking it. They're seeking us out. I think a lot of surgeons have started to innovate in this direction, and we're
Mm,
providing a kind of scaling model for that. And so, I think it's really, if they're wanting access to tech, if they want to build, all the things I just described, there's very few surgeons that are resistant to it. It's really just whether they're in the right time in their career, they're in the right time, if they're an independent surgeon or not. But we're
yeah.
getting a huge amount of lean in across the specialties, which is what we want, and what's going to kind of drive the
Yeah.
growth ahead.
Yeah. Is Well, final question then for us to wrap up. Do you anticipate then a trend towards more independence and outside of big machine hospitals as we go to this more, let's say, human first and analog and real touch versus, oh my gosh, there's a robot operating on me?
Yeah.
Or, yeah, tell me your thread line on that.
So two thoughts. I think our philosophy around AI and tech is that it should enhance the human experience. And so all our AI is about giving surgeons or staff more time to have meaningful interactions with staff,
Yeah,
or to do better in their day to day. There's a lot of companies, there's a lot of tech that's like, hey, you know what? I will automate a conversation between a nurse and a patient.
sure.
No nurse wants that. No patient wants that, in my
Mhm.
opinion. We want to
No.
give them time back to have a really meaningful conversation. Maybe it's a shorter conversation, maybe it's a more informed conversation, and maybe they're not documenting it after the fact. And the same with our surgeons. So that on the tech front, that's kind of a philosophy.
Mm,
And then as you relates to kind of the macro of consolidation and other things, I think there has been a swing in the last 10 years towards consolidation of the healthcare
mhm,
system, hospital employments, private equity, and kind of roll-ups. I think there's a recognition by independents that there's an opportunity to stand on their own 2 feet, to be
yeah,
supported with a platform to provide much more local, convenient, kind of patient-centric care. I think it does require platforms like Oath to kind of horizontally aggregate different
mhm.
independents to give them strength in numbers without them
See,
having
that's
to
the
kind of
thing. You don't
give up
wanna
the autonomy.
start it up well, I would just you don't wanna start this from square one. As a
Yeah,
surgeon, my specialty is this, but you could be in the space of wanting it and desiring it and just going like, "Well, but I don't have the bandwidth for that. I don't have the partner that's gonna set it all up, set it," and so
yeah.
forth. So, I get that struggle, yeah. Well, Oliver, it's been lovely chatting with you today.
Likewise,
What a fun time. What a
a
fun
lot of
time.
fun.
Did you finish your tea, by the way? What are we how are we doing
I
on
have not. No, my
okay,
aggressive
okay.
amount of green tea will take me a little bit of time to.
Okay, well, we have things to do in the rest of the day to do them. So lucky us. Oliver from Oath Surgical, thank you so much for being on here with us today. This is good.
Thank you, Beck. Really appreciate
I,
it. It's
I,
been
I
fun.
feel confident for the outpatient experience moving forward.
I'm excited. Thank you.
Needed, needed. Yes. Thank you.
Indeed. Thank you.